Okay, so hello, good morning. Judy, thanks for joining us and welcome to this discussion. So, tell us if the sound is good. Sometimes we have issues with our sound, so please tell us if the sound is okay. And while you're at it, please tell us where you're watching us from. While you're at it, tell us where you're watching us from. Is the sound okay? Okay. Good morning. Oh, good. Excellent. Yeah. So, okay. Excellent. Thank you so much. Somebody has just told us that the sound is good. So, today we will take at least, 15 to 20 minutes to talk about this very important subject that was requested by you. Remember, a few days ago, we asked you to suggest some topics, and this one was quite strongly suggested by quite a number of you. And, and that's why we're addressing it today. And also, before we get started, we would like to thank our sponsors, CarePick Specialist Clinic, for bringing this topic to you. CarePick Specialist Clinic is located in Roadspark on Omero Mumba Road here in Lusaka. And also, we would also like to take this opportunity to remind you to go and get vaccinated. Go and get vaccinated against COVID. We are counting on you. Your relatives are counting on you. We don't want, to lose lives when the fourth wave arrives. I know some have accused us of being fear mongers or engaging in fear mongering. It's not our intention. Our real intention is to save lives. That's all. That's our only interest. We have no other interest in this. Others were accusing us of being sponsored by imperialists. Others even said it directly, are you paid by Bill Gates? I've never even met the man. The reason we are talking about vaccines is because we know they work. So go and get vaccinated. To the topic. So today we are discussing a very important condition called pelvic inflammatory disease. This is a disease that affects women only. And pelvic inflammatory disease, by definition, this is an infection that affects the uterus, it affects the tubes or the fallopian tubes and the ovaries. So it's mainly an infection. All right. And generally speaking, when you talk about causes, pelvic inflammatory disease is sexually transmitted, commonly. And commonly speaking, there are two notorious bacteria that are associated with pelvic inflammatory disease, and these are gonorrhea and chlamydia. Those are the two main bacteria that are associated with pelvic inflammatory disease. And generally speaking, majority of the time, pelvic inflammatory disease is a sexually transmitted illness. Now, can you still get pelvic inflammatory disease even if are there other mechanisms of getting it that don't involve sex? Yes, but those are not common. Those are rare circumstances. For example, you can get an infection climbing up all the way into the uterus, especially during your periods. Rarely it happens, it's very rare, but sometimes it happens. Because when you're having your periods, that protective plug that sits in the cervix to block things from going up into your uterus it falls off, or to allow for the period. So in rare circumstances, okay, that has happened where somebody did not necessarily have unprotected sex, but they had they ended up getting a PI, a pelvic inflammatory disease, and under those circumstances, you'd find that the bacterium would be different. Under other circumstances under which these things can happen is if you are having a procedure, okay? in the vaginal tract, you're having a procedure, or they're inserting something and sterile conditions were not observed, you can get an infection going all the way up. But generally speaking, I need you to understand that the commonest cause is sexual transmission. That's the commonest cause. Having said that, what are the symptoms of pelvic inflammatory disease? Usually you would have, the commonest feature you have is pain. It is a pain in the lower abdomen. So you have pain that is below your belly button, okay, and above your hip in that area. Pain below your belly button, but above your hip in that general area. That is where the pain would be when you're having pelvic inflammatory disease. Now, I need you to understand that pelvic pain, or the location of the pain I'm describing, there are other things that can cause it, and they are not always because of pelvic inflammatory disease. So then how do you distinguish those things from pelvic inflammatory disease? I will explain. So the other things that can cause pain in that area, it's fibroids. Okay, so just because somebody has lower abdominal pain, it does not mean that they have pelvic inflammatory disease, although it's the first thing we think about in a woman. But bear in mind that there are other causes. For example, the other causes are things like fibroids. You have things like appendicitis, endometriosis, chronic pelvic pain, you could have a cyst in the ovary that can give you that as well. You could have a tubal pregnancy or ectopic pregnancy. It can also give you pelvic pain. So just because somebody has pelvic pain, it does not mean that it's PID. So then what distinguishes PID, or what distinguishes pelvic inflammatory disease from other causes of pelvic pain, is that with pelvic inflammatory disease, the one we are discussing here, unlike the other causes, someone would come with a fever, chukikupya. They may have a fever, and they will have also, in addition to that, they will have a foul-smelling discharge, a vaginal foul-smelling discharge. They may have abnormal vaginal bleeding, especially the bleeding that usually this type of bleeding happens in between periods or during intercourse. They may experience very painful sex, usually. Okay, and the reason they are having painful sex is because of the irritation that you're causing, and the event that you're causing. It may cause, the inflamed organs to cause pain. They may also experience nausea and vomiting. So if somebody has pelvic pain with foul-smelling discharge, vaginal, bleeding, abnormal bleeding, either between periods or during intercourse or painful sexual intercourse, you have to consider seriously on top of your list pelvic inflammatory disease. What are the risk factors? Why is it that some people are vulnerable to pelvic inflammatory disease? So the risk factors for pelvic inflammatory disease are a female who has multiple sexual partners, or a female who has a partner who has multiple sexual partners. All right, those are the key issues. A female who has multiple sexual partners is vulnerable to pelvic inflammatory disease, or a female who has one partner, but that one partner who is male has several sexual partners. Okay, that's what predisposes you to. That's the risk. The other risk is this thing of having unprotected sex. If you're having unprotected sex, so if you're going to have unprotected sex, limit and watch the number of partners that you have. If you're going to have unprotected sex, watch the number of partners that you have. Stick to one partner if you're going to have unprotected sex. Now, the other risk factor has to do with the steaming, the vaginal steaming that women like to do. Some, anyway. When you do that as a female, this vaginal steaming that you like to do, or this thing that you like to go and you do a cleansing of the vaginal tract. I don't know who teaches you these things. I don't know the value of these things. And I remember last time we discussed this. The vaginal tract physiologically has enough mechanisms to cleanse itself. It does not need your help. But some of you take it upon yourselves. You sit in these places and you start going to do steaming. And because you do that, you disturb the bacterial balance within the vaginal tract. And when you do that, you open yourself up to all kinds of infections, and pelvic inflammatory disease is one of them. It's one of the infections that you open up yourself to. Okay, those are some of the risk factors involved. So be careful. So, what are the complications? Why are we discussing it? Why is it such an important conversation? It's an important conversation because when pelvic inflammatory disease is not properly treated, and the reason sometimes you can easily miss it is because not every woman will present with symptoms. Sometimes pelvic inflammatory disease has no symptoms. So this woman has had pelvic inflammatory disease and they have no symptoms. There's no low abdominal pain, there's no discharge, there's just nothing. And then she's running an infection. Okay. A disease condition called chlamydia does that. Sometimes it may not have symptoms, and yet it is there, it's ravaging. Okay, so be very careful. So, because you may not see it, or sometimes it is inadequately treated, and sometimes you delayed to go and seek treatment, or sometimes you because of what you call self-prescription, you prescribed yourself wrong antibiotics, you may develop very, very serious complications. And that's why we're discussing pelvic inflammatory disease this morning. One of the complications of pelvic inflammatory disease is that the tubes may be blocked on both sides. And when that happens, you will find that as a woman, you start having problems having children. You've tried everything to get pregnant and it's not working, and they go and check your tubes, they find that your tubes are blocked. The other thing that can happen is what we call tubal pregnancy, where you end up with an ectopic pregnancy in the tube. Why? Because the infection was not properly controlled, you're healed by fibrosis and scarring, and the pregnancy falls in the tube. The other complication that can happen because of this is where you end up with an abscess, chipute. You end up with an abscess in the tube, or an abscess in the pelvis itself. Okay? So that can also be a very serious problem because it now means that you have to undergo serious surgery to fix it. The other long-term complication is that the same pelvic inflammatory disease can become long-term, where you end up with what we call chronic pelvic pain, where you have pain in the pelvis that is not going away. And you're always on painkillers, to sort out this pain that is not going away. All right. Now, we said that this is the leading preventable cause of infertility in women. So, how do you prevent it? For women especially, be very careful. Avoid multiple sexual partners. And if you have a partner whom you suspect has multiple sexual partners, insist that they use a condom. Okay? And avoid those things you like doing. This thing where you put jig, I don't know what you put at vaginal cleansing. I don't know why you call it that. I don't even know why you do it. Those things you call vaginal cleansing that you like doing. Some of you use steaming, I don't know what you do. But I've heard rumors. Those things, stop it. Just stop. because the vaginal tract is well endowed with enough mechanisms to cleanse itself. So don't listen to anyone who tells you, go and put in this and the other for vaginal cleansing. For what? So that's how you prevent these things. Okay? And don't insert things like these things like doing sunko, what. All those things you like doing. Don't do those things. You're just opening yourself up to problems. Okay? Treatment. Fortunately, and probably that's why I'm even discussing this. Fortunately, pelvic inflammatory disease has treatment. Okay? Mankwala yariko. Pelvic inflammatory disease has treatment. So if you suspect that you could have it, get treated very quickly. But make sure you are put on the correct course of antibiotics for the correct duration. Hear me carefully. Make sure you are put on the correct course of antibiotics for the correct duration. Secondly, if your doctor says you do have pelvic inflammatory disease, then it means that your sexual partner also needs to be treated. That's how you sort out that problem. Your sexual partner also needs to be treated. Okay, so we can't just treat you alone. So your partner needs to come and treat. Just make sure that it's a legitimate partner. Otherwise, it must shoot. So make sure your sexual partner is also treated. All right. That's all we wanted to discuss about pelvic inflammatory disease this morning. And thanks for joining us. And thanks to CarePick Specialist Clinic for bringing this conversation. And thanks to you, actually, for suggesting this topic. There are quite a number of topics you have suggested that are quite interesting. So we'll cover them. We have time. Don't worry. We are still here. So in the meantime, share this video. Okay? Share this video as widely as you can. Click that share button. Make sure this video goes as widely as possible. We need as many people as possible to get this information, because infertility due to pelvic inflammatory disease is preventable. And pelvic inflammatory disease itself is treatable. Okay? It's treatable. So don't shy away from hospitals, and do not self-prescribe antibiotics. Go and get the proper prescription for it. Okay? All right then. Until next time, do take care and good morning.